Chapter 3 of Module 2, we're going to be talking about moral trauma and burnout. And to link that to our previous chapter, why maybe this is actually a more appropriate thing to be talking about more often in our profession. So remember in the last chapter, we talked about compassion fatigue, empathy fatigue, compassion satisfaction, in fact, and that perhaps we'd been using some terms wrong all along, right? And I set you up with the suggestion that perhaps empathy fatigue was a better term for that cared so much we ran out of caring vibe that we sometimes experience. But now I want to challenge that one step further and suggest I don't actually believe on most of what is happening for veterinary and animal professions that empathy fatigue is really what's going on. Because when we have conversations and when we survey vets and veterinary professionals who are leaving the profession for what's going on with them and what's going on in their head, that empathy fatigue is kind of just a surface level sometimes there. And in fact, it's usually a little bit more complicated than that. And what we are in fact discovering, finally, a little bit delayed, is that most of the time, the thing that is causing strong levels of not being okay in our profession is something called moral trauma or moral injury. Moral trauma is a term that was coined by the American medical profession. Now, just like the veterinary profession, the American doctors and nurses have to make medical decisions based on financial capacity. And that is why they actually are quite comparable to our profession in terms of the emotions and the ailments that they experience. So what you've got is medical doctors and nurses who have gone into the profession generally because they are wanting to help people. And then they find themselves in medical situations where they've got, people lining up outside bleeding and they can't help them because they can't show their insurance. Or you have to bankrupt somebody to give them chemotherapy. Or somebody has to choose whether or not they can get kidney transplant, not because there's not the availability there, but because they don't actually know how they can do it. And so people of different demographics have access to different types of care. And so you've got these medical professionals who are constantly having to provide treatment plans, or the lack thereof, against their own moral and ethical compass, right? They are having to make choices that don't align with their values. And that, every little time we do a tiny little thing that doesn't quite fit with what we think is the right thing to do, or when we witness someone else do it and we're powerless to stop that, that is a moral trauma. And what they're discovering, the more and more they study this, is that for every little moral trauma you have, whilst they might be small and you might cope with them fine at the time, they leave something called a moral residue. And so they leave this little bit of never quite returned to baseline after that trauma. And that's why so many people who experience quite a significant burnout or not being okay event, the thing that finally cracks it is usually not this major overwhelming moment. Often it's something that they've done 20 or 50 or 1,000 times before. It's just this particular time, the residue left from all of the other times was too high, and this particular moral trauma was too much. And what they find is people who have experienced this have the same pattern in their brain scans as people coming back from war with PTSD. This is effectively being seen and categorized in your brain in the same way as soldiers are experiencing post-traumatic distress. All right. And this is what is going on for a lot of veterinary professionals and animal shelter and animal rescue and welfare professionals globally. Every day we are forced to act in these tiny little microscopic ways that don't necessarily align with our ethics or our morals or our values, or we watch someone else do it and we're powerless to change that. And over time, this creates moral injury. And you can start to see here why having this language, being able to articulate what's actually going on for you, is so much more important than you might think. Because if we're seeking help for compassion fatigue, when what's really going on is moral trauma, we're getting the wrong help. We're having the wrong conversations. We're using the wrong tools. And this is why it's so important for us to start thinking outside of the square of 2 decades old version of solutions to our challenges. I also want to touch briefly on burnout. Now, burnout is something that it doesn't have a very clear definition of its own. But to be really clear, the reason I wanted to just touch on it is a lot of people are, feel that, oh, I'm feeling quite burnt out. I need a week off. If you can recover with a week off, you're not experiencing burnout. You're experiencing fatigue and exhaustion and lots of other things, I'm sure. But burnout in itself is actually when your brain is done with this. Okay, you actually have tipped over a line whereby, that brick wall that we talked about, when robust is not the same as resilient, you've either snapped the rubber band or you've broken the brick wall. Okay, and to experience burnout is quite a significant life event, and a lot of people who experience this find themselves either off work for many, many months, sometimes years, or never able to return. And this is why I think it's really important, not because I want to invalidate the fact that you might be feeling burnt out, but I want to give due credence to people who are going through or have been through this. And I also want to use it to maybe help you understand, for those of you who have experienced some version of this, and then the amount of vets that I talk to who have come back after a week off because they were feeling overwhelmed, and then they come back going, oh, why am I not okay? And they've just had this, this break, and they feel grateful because their employer was kind enough to give them time off. And then they suddenly find themselves crying 5 times a day. Or somebody asks them how they are and they burst into tears and they don't understand, and they give themselves a lot of hard time for what is wrong with me. Why can't I get back to normal? Because they're not giving themselves the acknowledgement that burnout isn't just exhaustion that needs a holiday. Your brain needs to rebuild some mechanisms here. And you can start to see why semantics really do matter.